In this presentation, we will discuss steps to solving a medical coding exam case study. But first, I want to introduce you to the team. First up, Mr. Sandeep. Mr. Sandeep coming to you live from Abu Dhabi. He is an AMCI co-lead instructor. Next up, Miss Eva coming to you live from the state of Florida. She's also a co-lead instructor and the intern coordinator. And finally, myself, Mrs. J. I'm the curriculum director at AMCI. Now, let's meet the AMCI interns. We have Miss Anubama, followed by Miss Carla, Miss Courtney, Miss Dolly, Miss Vivian, and Miss Melissa. Goals of the presentation. We will extract the correct codes from anesthesia documentation. Now let's talk about how to solve a multiple choice case study scenario the AMCI way for the board exam. This is how we do it. We teach you to highlight your key terms, and this key on the right tells you the colors that you should use and for what. A yellow highlighter should be used for diagnoses, all diagnoses, signs, and symptoms. The green will be for procedures. So if you have a green highlighter, the green will be used to highlight only procedures. And pink, these are inclusive or bundled items. All right? Once you've done your highlighting, you're going to have to document your inventory. That's your procedures, diagnoses, and select a primary code. Which diagnosis is primary, which procedure is primary. Then you're going to review all pertinent guidelines. And finally, the code that best matches your inventory list is often the correct code, or a code that is pertinent to a guideline. That will be your best code. All right. So here are some do nots. When you're highlighting, you can kind of get discombobulated. So we've compiled some things that you don't even have to highlight. Number one, don't highlight things observed by the physician because you cannot code for them. Number two, don't highlight closures. If a provider or surgeon is closing up a surgical site, there's no need to highlight it. However, if it involves a skin procedure or skin defect closure, you may definitely have to code that. So if it's closing a surgical site other than skin defects or wounds or lesions, you do not code it or highlight it. Also, you don't highlight bleed control, hemostasis, because that's pretty customary and it's bundled into the procedure code. You don't highlight drains, irrigation of the surgical site. Nope. And you don't highlight installation and removal of clamps and trocars because these are used to open up or maintain the surgical or operative site so the physician can view what they're doing, particularly if it's an open procedure. Also, you don't highlight dressings. And finally, you do not highlight surgical risks. Now that we've gotten that out of the way, I think you're ready to get started, and I'm going to hand it over to Mr. Sandeep. All right, Mr. Sandeep, take it away. My apologies. Miss Eva is going to begin by reading the first scenario. Take it away, Miss Eva.
now we're gonna start with anesthesia. I will read the first scenario, Mr. Sandeep, and afterwards I'll give them over to you. So, anesthesiologist personally performed case. Anesthesia time 1304 to 1341. Physical status 3. Preoperative diagnosis RLL lung cavity, possible C8 of lung. Post-operative diagnosis is a right lower lobe lung carcinoma. Procedure bronchoscopy. Anesthesia monitor anesthesia care. Procedure description: with the patient under satisfactory anesthesia, a flexible fiber optic bronchoscope was introduced via oral cavity and advanced past the larynx for visualization of the bronchus. Cells washing were obtained and sent to pathology. The bronchoscope was then removed. Patient tolerated procedure well. Cell washing obtained from the right lower lobe were confirmed by pathology as malignant carcinoma. I am so sorry, coders, I forgot to read my answers first. A 00520 AAQSP3, C34.3, B 00522 AAQSP3, C34.3, C 00528 AAQSP3, C34.3, and D 00540 AAQSP3, C34.3. What CPT and ICD-10-CM codes are reported for the anesthesiologist? What is the time reported for these services? Coders, you have 2 minutes, Mr. Sandeep.
So we will give them 2 to 2.5 minutes time.
Okay, they're all yours.
And that is 2 minutes 30 seconds, Coda. And from what I see from the chat, around 100% of of the coders have said the correct answers. What a way to start this beautiful evening. And you guys are right. Awesome, awesome anesthesia coders. Okay, still it's my duty to go ahead and let you all know how I arrived into the correct answer for this one. Let's have our keywords. This is the FTR for anesthesia. We have to check whether it's a surgical procedure. Well, we have to find the time, provider type, physical status, the qualifying circumstances, and only use of general anesthesia or blocks. These are the keywords. Anesthesiologist personally performed the case. So what's the modifier going to be, coders, for this one? When the anesthesiologist personally performed the case. Let's make this final session interactive. Let me have a look into the chat. What modifier do we apply when anesthesiologist personally performed the anesthesia service? Yes, it is going to be AA. And the anesthesia time is 1304 to 1341. The postoperative diagnosis is right lower lobe carcinoma. The procedure which is performed is bronchoscopy, and anesthesia which is given is a monitored anesthesia care. And quickly, what will be the monitored anesthesia care modifier? Quickly, coders. Yes, I said you guys are awesome anesthesia coders. QS modifier. That is what we apply when a monitored anesthesia care has been given. And we are having P3 status, physical status modifier as well here. So in the description of the procedure, a bronchoscope was introduced via oral cavity and bronchoscopy was done. So the correct answers, as you all said, for this scenario is going to be option A. And let's look how we arrived into the option A. These are our code options. What will be the anesthesia time for this scenario? Quickly, coders, anesthesia time for this one. Okay, I got the first response. Okay. The first one, I'm asking about the anesthesia time. Next, I will ask about the anesthesia unit. So now I just want the anesthesia time for this one. Yes, there we go. Now we got the answer. Anesthesia time for this one is going to be 37 minutes. We'll find the difference between the 1304 to 1341, and that is going to be 37 minutes. And next question, what will be the anesthesia unit? Okay, anesthesia unit for this one is going to be 2 units. How we got that? We'll be dividing the 37 minutes by 15. That will give us around 2.4. Since not reaching 2.5, we won't be rounding that up, and it will be 2 units. If it reaches around 2.5 or 2.6, from there onwards, we will be rounding that up to 3 units. Since it's just 2.4, it will be only 2 units for this one. I hope that's clear. Okay, now let's look into the answer. I've done some churning before I arrive into the correct answers. So the code 00520 will be coding for closed chest procedures not otherwise specified. 00522 is coding for a closed chest procedure with a needle biopsy. 00528 is coding for mediastinoscopy plus thoracoscopy, and 00540 is coding for anesthesia procedures thoracotomy procedures in the lung, diaphragm, and mediastinum. So let's look the procedure which is performed. It was a bronchoscopy that was performed, and a flexible bronchoscope was used. So this was not a thoracotomy procedure. 00540, that is not what we have performed. So that's the wrong answer. And option C, 00528, what that's coding for is coding for a mediastinoscopy. Why I'm getting this wrong? Plus thoracoscopy, and that was also not the procedure performed. Neither we did use a needle biopsy in this scenario. So option B is also wrong answer. The correct one would be option A, 00520. Since it's not specified, we'll go for closed chest anesthesia for the closed chest procedures, including bronchoscopy, not otherwise specified. So we already have including bronchoscopy over there. So this is the correct answer for the first scenario of the day. Well done, coders. All got the correct answer for that one. I'm so happy for that. Well done. So let's move on to the next scenario, scenario 2 for the 4th week. And I would invite Miss Vivian to read the scenario for us. Miss Vivian, take it away.
All right. What CPT and ICD-10-CM codes are reported for the CRNA? What is the time reported for this service? A 00840 QZQSP3 and 13.5, B 00880 QZQSP3 and 13.5, C 00862 QZQSP3 and 13.5, or D 00860 QZQSP3 and 13.5. Anesthesia start 12:18, anesthesia end 13:31, CRNA John Sleep, CRNA non-medically directed, physical status is 3, operative report, preoperative diagnosis, stricture of the left ureter, postoperative diagnosis, same, procedure 1. Cystoscopy of ileoconduit, 2. Exchange of left nephroureteral catheter, anesthesia, monitored anesthesia care, description of procedure. The patient is identified in the holding area marked, taken to the operating room. Subsequently, she was given monitored anesthesia care. She was prepped and draped in the usual sterile fashion in the supine position. Next, using a flexible cystoscope, the ileoconduit was entered. Cystoscopy was performed, which showed the ureteral ileal anastomosis on the left, with a stent protruding from it. There were no calcifications seen on the stent. Thus, the cystoscope was removed from the ileal conduit, and then a super stiff wire was advanced through the nephroureteral catheter up into the kidney. Once it was up there, then the catheter was taken off of the wire, and then a new 8 French 28 centimeter nephroureteral catheter was advanced fluoroscopically into the level of the kidney. Once this was done and its position was confirmed fluoroscopically, the wire was pulled. A good curl was there fluoroscopically in the kidney as the wire was pulled. A good curl was seen in the bladder, and then the distal end was protruding out from the ileoconduit. This was placed in the ostomy bag, and the patient was seen in stable condition to the recovery room. Okay, coders, your time begins now.
That's time coders, and I can see a traffic between C and D. Okay, let's solve the scenario. And the keywords, the preoperative diagnosis and the postoperative diagnosis are same for this one. It is going to be the stricture of left ureter, postoperative. And the procedure performed is a cystoscopy of ileal conduct and an exchange of left nephroureteral catheter. Monitored anesthesia care was given. And the correct answer for this one is going to be option B. Let me have a look into the chat. Yes, I know there will be questions arise for this one, and let's go and solve this one. So we are having the FTRs, the bottom we are having our code options here, and the time coders. I want you all to put your time, anesthesia time, in the chat. Anesthesia time for this scenario. Yes. Anesthesia time for this one is going to be 73 minutes. How did we get that answer? We find the difference between the anesthesia start and the anesthesia, and that is going to be 1 hour and 30 minutes. As most of you have said, that will be 73 minutes. And the anesthesia units, what will be the anesthesia unit? This time you're not going to mess with this. We'll divide 73 by 15, and that will be 4.8, which we will be rounding this time to around 5 units. So we won't be placing the units in decimal points like 4.8. We won't be placing them as 4.8 or 0.6, something like that. We will just round that up and we'll find out whether it's 5 units in this scenario. So anesthesia unit is going to be 5. I hope the anesthesia time and anesthesia units are clear for most of you. Okay, let's go and solve this one. Let's look into option A, that will be coding for anesthesia for intraperitoneal procedures in lower abdomen, including laparoscopy, not otherwise specified. Why do you think this one is a wrong one? Why do you think, coders? Why do you think option A is a wrong answer? Come on, coders, let's make this session interactive as possible. Why do you think option A is wrong? Because it is coding for intraperitoneal procedures. So intraperitoneal will be mostly on the organs of the abdomen, stomach, and all those organs. So this is a wrong one. We didn't had procedures on intraperitoneal organs or intraperitoneal procedures. You got that one? Why that was wrong? Okay, let's go into the next option. Option B, that will be 00880. Let's have what it is coding for. It is coding for anesthesia procedures on major lower abdominal vessels, not otherwise specified. Was any procedure performed on abdominal vessels in our scenario? No, yes. There was no procedures performed on abdominal vessels. So that one will be wrong as well. Now, what I saw from the chats, many of them are saying option D, and many of them are saying option C. So let's see why option C is going to be wrong one. This one is coding for 00862 is coding for anesthesia on extraperitoneal procedures in the lower abdomen, including urinary tract. Till that, it's correct. On the renal procedure, it will be renal procedures, including the upper 1/3 of ureter or donor nephrectomy. So it is very important to know what kind of procedure is performed while coding anesthesia questions of this kind. because it will help us differentiate between the correct and the wrong answer. So in our scenario, we are having a cystoscopy of ileal conduit and an exchange of left nephroureteral catheter performed. So this will be the procedure which is performed. You know, the ileal conduit will be like doctors will take a portion of the intestine and they will create a path, as you can see in the image. So here the urine will be draining out through the ileal conduit to the external opening, that will be a stoma, and there will be a collecting bag for that as well. So this is actually the procedure performed. So doctor has performed a cystoscopy of the ileal conduit. They will be examining this particular portion and to see it is all good, and then he has performed a catheter, nephroureteral catheter replacement as well. So a portion of here, they will be removing the catheter from here. So that's the procedure performed. And does the code 00862 exactly specify what the procedure performed? 00862 will be anesthesia on extraperitoneal procedures in lower abdomen, renal procedures, including the upper 1/3 of the ureter. So as you see, so from the diagram, this does not exactly say it's a procedure totally on a renal system, and it's only including the upper 1/3 of the ureter. So that doesn't exactly specify the procedure which is performed. So in that case, the correct one will be option D, 00860, that is anesthesia for extraperitoneal procedures in lower abdomen, including the urinary tract, not otherwise specified. Is that clear, coders?
Thank you, Mr. Sandeep, for those AMCI amazing and awesome explanations. Miss Eva, for being the orchestrator and conductor of the best interns on the planet. Yes, I said it. Miss Melissa, Anubama, Courtney, Carla, let's get it, let's code, Dolly, and Miss Vivian. And let's not forget our interns in the chat, led by Miss Biji. And you, the students, you all are simply the best, and we appreciate you. And we will see you next time for more great scenarios. You don't want to miss it. And thank you for participating in the AMCI Medical Coding course. Until next time.